Hi there, Lynn Cox, clinical hypnotherapist. I work with women who have escaped domestic violence relationships and also experienced childhood abuse. So, want to jump right into it. The question of memory disassociation and is it necessary to remember the details of events in order to heal and move past them? So, I want to set up this conversation a little bit because I'm going to be talking about two different instances. One, people who experienced childhood abuse and CSA, and then two from the domestic violence experience. So my short answer to it in terms of is it necessary in order to be able to heal? The short answer is no, and I'm going to explain why. But I want to point out a couple of things. If it is the case that somebody is involved in the injustice system or is involved in any kind of criminal reporting or the legal system seeking justice, remembering specific details then may become very necessary. But I'm not going to look at it from the perspective of that. So I'm talking about this purely from the perspective of healing and recovery. And what I mean by healing and recovery is the quality and experience of life in present day. So, from that perspective, I'm not talking about considerations where it's necessary to recall specific detail in a legal situation or what's the other? Yeah, so not specifically around that. And then it's about the kind of the definition is related to what's your life experience like present day? Because there are a lot of common and typical symptoms that people who have experienced childhood abuse, CSA, and domestic violence include. Specifically, PTSD symptoms, issues with addictions, depression, weight gain. I mean, it really kind of runs the gamut of what we would classify as negative experiences in life. Challenges trusting people, challenges having harmonious, mutually respectful relationships, being able to have boundaries, being able to have self love, self trust, self respect, and self appreciation. And also sometimes issues with knowing, like, really, like, who am I? A lot of people struggle with that, particularly if they've been abused as children, because that can stunt development. A child who grows up in a safe and warm and loving environment it's much easier for them to perceive the world around them and people around them as safe, and then be more comfortable being able to explore, be curious about the world and explore and know who they are. So the other thing I will say is our subconscious minds do record every experience that we've ever had. So it's not necessarily available in our day-to-day conscious thinking. My name is Lynn, it is this date, it is this time, I'm here. Things do get recorded, so memory retrieval is possible if that's really a goal. But does somebody's current experience of life and then future prospects hinge on recovering memory? Absolutely not. It absolutely does not. And this is my opinion. This is only my opinion, and this is based on personal experience as well as experience with clients and knowing what kind of outcomes colleagues, clients have had too. So that's my opinion. There's no settled definitive answer on this. So this is my perspective, my opinion, because I have seen certain things and different approaches. So, memory retrieval or remembering what happened to you, let's say if you were a child who was abused or experienced CSA, sexual abuse as a child. I'm wary of saying that word because I feel like it does get maybe flagged on social media channels. So, not everyone can recover every instance of something at the snap of a finger. It's totally impossible. I mean, we can try to focus on things, and you'll notice if you're an adult or if you're like middle-aged and you look back on your life, there will be kind of these like key memories representing milestones that pop up. So often what happens when children are abused at a young age, sometimes that memory can get basically, I'll be really simplistic about it, but basically wrapped up and tucked away. Wrapped up and tucked away. Often children will dissociate. So a lot of people report feeling like they were out of their body maybe while they were being abused. Um, and that's a protective mechanism, specifically for children. When people need to deal with extraordinarily painful and violent and traumatizing situations, that is a protection mechanism because that is too much for a young psyche to handle. So that's often why there will be that disassociation, and then also that let's wrap up these memories and tuck them away, and then maybe they'll resurface at a time when the whole system feels that you are able to deal with the difficult truths of the situation. And that's not to say that all of the memories will come back, but people will report often, sometimes if they've been abused as a child in their teens, sometimes it's at points when the hormones start to change in the body. So during the teenage years, as well as in the 30s, and then also the menopausal ages for women. That's something that can kind of trigger some of these memories to pop up. But that's kind of what happens. It's a protection mechanism. Some people, where it becomes difficult for people, and I'm speaking about the case of children who have been assaulted, abused, and experienced CSA, is that when they're older, they kind of will they'll talk about feeling like I know this happened or I have a vague memory, but they feel like they have a deep knowing. For example, like I feel like I'm pretty sure for example, my grandfather did this to me, but I don't remember all the detail. And that's something that can be very difficult for people because it's one thing to be able to process that you were abused as a child, very challenging. It can be done, and it can actually be done a lot quicker than a lot of people think and believe. But then to have that added layer of confusion if the memory's not crystal clear, and because it's a really terrible, atrocious crime to have been committed against a person, particularly a child. It can be difficult to accept. Bottom line, just it can be difficult to accept. So the combination of patchy, spotty memory coupled with that can make it difficult for people to accept it. And then the other thing that people do talk about experiencing a lot if they're abused as children and then having some spotty memory and having some memory, the feelings of guilt and shame often that adults feel about being abused as children is that often children won't fight back or run away. But that's because they can't. So that's totally a normal reaction to a highly abnormal situation. So that can be hard to reconcile as a teenager or a young adult or an older adult or middle-aged adult. So all those pieces need to kind of fit together. But when it comes to the part about healing and feeling better and being able to move past that, some of the most important things in my experience and in my opinion that can be helpful for people is if you're able to change the emotion around that. So I'm going to go back to this example of being abused as a child, starting to have some recollection and memory as an adult, feeling confusion, reporting feelings of feeling guilt, shame. Oh, why didn't I fight back? Why didn't I run away? Was I somehow complicit? These questions often come up for people. What it is it's not the act itself. This might sound very odd, but for that particular individual, it's not the act itself that's problematic. It's all of these emotions and beliefs and confusion going on inside of them that is becoming problematic. That is very likely the source of feeling distrust or not knowing why they're feeling on edge, or why is it that I'm hanging on to this weight, or why is it that I'm waking up in the middle of the night feeling like I've had nightmares and don't know what it's about. That's the part of it that's problematic, and that's the part that can be overcome, because really needs to happen what needs to happen for real healing without specifically memory retrieval is to be able to integrate that knowledge. So it is and I've talked about this before, the ability to look at a difficult and hurtful truth, but not to stay there for too long. We don't stay there for too long and dwell there for too long. And then to be able to change the belief structure that was informed by those very strong emotions, and be able to basically recategorize all of that. Recategorize it in a way that people are then able to truly accept and know that, and I'm talking about the childhood abuse situation. I think I'll do another video specifically about domestic violence, because this one is getting a little bit long. But these are important points to point out and share. So it's like the recategorization or the integration of that knowledge, but then of the emotions and the beliefs. Because again, talking about the difference between the conscious mind and the subconscious, somebody can very much with their logical mind think about a situation where it's maybe a 6-year-old child who's being abused by an authority figure or an older family member, and say, of course that's wrong. Logically, of course that's wrong. Anybody would know that's wrong. Anybody would know that's a horrific crime. And also, anybody would know that clearly that child didn't have there was no recourse for that child at those ages in that time, because of so many reasons. I don't think I need to go through that list of them. So it is really being able to, for the person who experienced the abuse, though, to be able to not just logically know that, because that's why talk therapy sometimes in these instances isn't helpful, because if the shift and the change doesn't happen at the emotional state and the belief level, they could say, yeah, of course it was their fault. Yes, of course there was nothing I could do. But unless it is truly integrated and believed, it then will be more difficult to overcome some of whatever the symptoms are, because everybody does experience, and I call it symptoms, different types of symptoms, whether it's issues with substance abuse or overeating or relationship issues or adult sexual dysfunction, or high feelings of anxiety or depression, because it can run the gamut, it can run the range. So until there is that belief at the level of the belief structure and knowing it, not just logically knowing it, but integrating that at the emotional, at the subconscious, and the belief level. And then when that changes, and that is known with certainty, then things can change radically quickly for people. Their whole perspective of themselves then can change. And there is some memory work that happens, like the way I work with clients. We do regress to different scenes from the past that have to do specifically with their kind of most pressing issue in that moment. So, be it depression or substance abuse or extra weight, for example. And so they will go back while they're in hypnosis. And people who have been abused as children, they often will go back to scenes, but we set it up in a way where it's not scary. They know that they're not reliving it. So there is memory retrieval from that perspective, but the point of that is to get to the point of what were the emotions that were deeply felt, and then what beliefs were formed as a result of those emotions. And then once that's recognized, that can be interrupted and changed. So remembering everything, remembering every detail, remembering, frequency and specifics and things like that, it is not necessary to achieve healing. It is, however, everybody's personal choice and personal preference if they wish to remember more. And if somebody wishes to remember more, everything is stored in the subconscious, and there are definitely methods to get at that. I would just, ask a few questions, or a few questions for consideration. Why is it that you'd want to know more detail? Is it to confirm that your memory or your impression that something happened is actually true? Is it that the case? Is the case because you're pursuing legal action, in which case you need to know more detail? That's a question to ask. Or is it because you have a belief that if I can't remember what happened, I'm going to be stuck here forever? And if that is the case, I just want to share the message that it's not a requirement. It is not a requirement. It's not a requirement to heal in different ways, to feel differently about yourself, to move forward in life in ways that you desire, to feel more calm, more secure in yourself, more safe with yourself, more tuned into your intuition and judgment, having more trust in yourself, and then having more care for yourself. Because we take good care of those things that we really love and appreciate. Also to basically eradicate those feelings of any kind of guilt or shame. That can be a really big change and a really big game changer for people. So remembering more is not a requirement. You just need to ask yourself, okay, why do I? And also maybe ask yourself, what's most important to me now? So if you're an older teen, in your 20s, in your 30s, in your 40s, in your 50s, I've worked with people of all ages. Ask yourself, what's most important to you right now? If you had to pick one thing that's most important to you, would it be remembering detail of the past, or would it be, overcoming feelings of shame, or like you don't really like yourself, or wanting to shed this weight that you really just don't understand why it's hanging on, for example. So ask yourself, what's most important to me first? And what would I most like to experience first? Because you can work on, you can take things in steps and in chunks and multiple steps. So yes, memory retrieval, not a requirement for healing. I've only covered in instances of adults who have experienced child abuse. I will do a separate video talking specifically about domestic violence situations, and then women who kind of have spotty memory around that. That's a slightly different, not really much different, but yeah, healing's possible. You don't have to remember more detail if it's not a requirement for you or a choice of yours. And that's important too. Everybody has a choice in the matter. Don't let any therapist tell you, okay, we have to uncover, all of the detail in order for you to do this. It really is a personal choice. I'm just here to say, based on what I've seen and how I work with people, it's not necessary. And it's definitely possible for everyone to heal more rapidly, feel a lot better, and start to enjoy life much more. Bye for now.